Dr. Ken Landau. Thanks for watching. Let's talk about Zofran or Ondansetron. This is a treatment for nausea or vomiting. Came on the market in 1990, went generic in 2006. It's the 83rd most frequently used medicine in the United States with more than 9 million prescriptions. It's on the World Health Organization list of essential medications. Comes in a variety of forms, comes in a tablet, 4 or 8 milligrams. Comes in an orally disintegrating tablet in a little blister pack, again, 4 or 8 milligrams. It's important that you don't push the pill through the lining of the blister pack. What you do is you wash your hands, make sure they're very dry, you peel back the surface, take the pill with your dry hands. Very important they're dry, otherwise it's going to dissolve right in your hand before you get it to your mouth. You don't swallow the pill, you don't chew the pill. What you do is you place it on the tip of your tongue, and it's going to dissolve within 4 to 20 seconds, and then you swallow it with your saliva. No need to take any liquid, which is important, especially if you have nausea and vomiting, when you don't want to go and take any extra fluid. Comes as an oral solution, 4 milligrams per teaspoon. And then for those people who are in medical facilities, comes as intramuscular or intravenous injections. Now it's approved for those people who are receiving highly emetogenic chemotherapy. In other words, you take the chemotherapy and then you're going to vomit. And we can predict that it's going to happen depending on the dose, depending on the drug. Or some people receive drugs that are just moderately likely to cause it. Well, it's good for those people too. It's also good for people who are receiving radiation therapy to the abdomen that would tend to cause some nausea and vomiting, can help prevent that. Used for post-operative nausea and vomiting, and very frequently it's used for gastroenteritis. That's an off-label use, or for morning sickness, again, an off-label use. But very frequently used for gastroenteritis, multiple types, the morning sickness, or even a more severe form of nausea and vomiting associated with pregnancy that's called hyperemesis gravidarum, or in people who overdo marijuana or the cannabinoids. They can develop the cannabinoid hyperemesis syndrome. They have nausea and vomiting associated with the drug. Good for that therapy too. Also good for cyclic vomiting syndrome. Now, a lot of people suffer shivering after surgery, and a simple injection of this medicine about an hour before surgery can eliminate that. There's some evidence that it might help decrease the desire for alcohol, some evidence that it might improve the negative symptoms associated with schizophrenia, maybe a little bit more questionable evidence that it helps with tardive dyskinesia, might work as an anti-anxiety medicine. There was a thought for a while that it might help people discontinue cigarette smoking. That probably isn't the case. It helps with certain forms of itching. Itching not because of liver disease, not because of gallbladder disease, but itching, let's say, because you're receiving injections of morphine after an operation. It seems that the itching from the morphine goes away with the Zofran, or the Ondansetron. So the Ondansetron for gastroenteritis seems to be less sedating than a variety of the other medicines that are used, like the cyclizine and the bonine and the droperidol. Seems that if we can successfully decrease the vomiting and the nausea, then allow those individuals some time to rehydrate themselves so they don't have to be admitted to the emergency room to receive intravenous liquids. Well, if you take the medicine and you vomit within half an hour, you probably should take another dose of the medicine. Now, if you're receiving highly emetogenic chemotherapy, like high-dose cisplatin, you need a high dose of the medicine, so you take about 24 milligrams. If it's only moderately emetogenic chemotherapy, it's a lesser dose, and you take it somewhat more frequently, especially if you're going to be taking a course of therapy that lasts a while. Radiation therapy, again, relatively low dose, 8 milligrams rather, before the session. And if you're going to receive multiple sessions of radiation therapy, you're going to take multiple doses of the medicine. And post-operatively, if you want to prevent the shivering or the nausea or the vomiting, it's given an hour before the surgery. It can be used in kids even. Well, who shouldn't use it? Shouldn't be used if you have allergic reactions to the medicine, if you have an anaphylactic reaction to the medicine, and shouldn't be used if you're receiving a drug known as apomorphine. Apomorphine is sometimes used in people with Parkinson's disease. At the end of the course of therapy of the medicine for Parkinson's disease, the medicine tends to wear off before you take your next dose. And it's the period when you lose the muscle control. And that's when you would take the apomorphine. Well, you don't combine the apomorphine with the Zofran. If you happen to suffer from hepatic insufficiency, you have some problem with your liver, well, that can increase the amount of time that the Zofran is in the system. So the normal half-life is somewhere between about 5 and 6 hours. If you have mild to moderate liver insufficiency, it's going to be increased to about 12 hours. If you have severe hepatic insufficiency, the half-life of the drug is increased to about 20 hours. So that means that you shouldn't take more than about 8 milligrams of the Zofran. Now, irrespective of the level of kidney insufficiency, whether it's mild, moderate, or severe, doesn't seem to impact on the amount of drug that you could take. If you're pregnant, well, there is some controversy about that, some inconsistent results from some epidemiologic studies, only retrospective studies, so not really good studies. But those studies suggested that it might increase the risk of cardiovascular defects in the first trimester of pregnancy, increase the septal defects, little holes in the heart between the right side and the left side. But some of the studies showed that it was not linked to any kind of problem. There was a poorly controlled study that suggested, well, maybe there was an increase in the cleft palate. So if a person's pregnant, it may well be that other options should be considered first, like Benadryl or Meclizine or some of those kind of drugs. In animal studies, it doesn't seem that Zofran is harmful, doesn't seem to harm the fetus, doesn't seem to cause harm when the organs are being formed. But as always, you can tell that there is litigation over, well, some people say that the Zofran did cause some problems when it was used for morning sickness, and their children, their offspring, suffered harm. The FDA, however, rejected any warning label suggesting that there was a problem. Now, for lactation, it's unknown if it's in the human milk. It certainly is in the milk of rats. If we look at the pediatric population, it's approved as safe and efficacious for people over age 4 if they're receiving the moderately emetogenic chemotherapy. Interestingly, it's not licensed for people receiving the highly emetogenic chemotherapy. If we look at people who are over age 65, it doesn't seem that the metabolism of the drug changes very much, slightly decrease in the clearance, but that doesn't seem to cause any kind of problem. Side effects associated with the medicine, not very impressive, some headache or malaise or fatigue, sometimes some constipation or diarrhea, sometimes some itchiness, even though it can be used to treat itchiness. If it's injected too rapidly, not taken by mouth, but injected too rapidly, it might cause some problems with the hearing. And then there are some cases of sudden blindness. We call it amaurosis, but they only last for about 2 or 3 minutes and probably not really related to the medicine, seem to be related to the hypotension and faintness or vasovagal reaction, the syncope, the fainting that's associated with receiving injections. Well, it also is possible that it might seem to be related to a blockage in the conduction from the upper chambers of the heart to the lower chambers of the heart. But irrespective, everybody recovered. Sometimes it can cause hives, or sometimes it causes a rash. Sometimes a rash could be severe, like the Stevens-Johnson syndrome. It can mask an ileus, or the bowel not moving correctly. So if a person is taking the medicine, then the belly should be checked every once in a while to make sure that there's normal bowel activity. And if a person, under rare circumstances, has phenylketonuria, well, you have to be aware that the orally disintegrating tablets do contain some phenylalanine, component of aspartame, of course. Well, there's a question about, does it increase the QT interval? And the FDA got all excited in 2011 and suggested that there might be a problem. And indeed, there might be a small problem, so that people who have congenital prolonged QT interval shouldn't take the drug. And the FDA says you ought to monitor the electrocardiogram if people have low potassium, low magnesium, or arrhythmias or congestive heart failure. But for the overwhelming majority of people, that's not really an issue. Now, in a very small number of people, it might cause some bronchospasm or some seizures or some arrhythmias, might increase that QT interval and then lead to arrhythmias, cause some palpitations or some fainting or even some hiccups in some people. Well, if you combine it with certain other medicines, it might cause the serotonin syndrome. Could even cause the serotonin syndrome if it's taken by itself. And the serotonin syndrome comes on especially if you take it with an antidepressant like an SSRI, Prozac, Zoloft, or an SNRI, MAO inhibitor, mirtazapine, or if you're taking it with fentanyl or lithium or tramadol. Well, the symptoms of the serotonin syndrome, they can be pretty dramatic. So a change in the mental state, agitation and hallucination and confusion and coma. Some people develop some autonomic nervous system instability, develop tachycardia, fast heart rate, or labile blood pressure go up and go down, dizziness and flushing, sweating, body temperature can go up. They can develop some neuromuscular symptoms. They could be tremor or rigidity or increased reflexes, incoordination. Some people go on to develop seizures. And sometimes there's nausea, vomiting, diarrhea associated with it. People who overdose on the medicine, especially children, might have those same kind of symptoms that are associated with serotonin syndrome. Treatment is just to stop taking the medicine. Comes in really two different types. The Ondansetron hydrochloride dihydrate, that's the standard tablet. The orally disintegrating tablet is just the Ondansetron base. They're different molecular weights, slightly different structure. The mechanism of action, well, it antagonizes a serotonin receptor, a specific receptor. It's called the 5-HT3 receptor. It's not a dopamine receptor. It doesn't work on the acetylcholine. It just seems to work either peripherally on some of the vagus nerve terminals that have the serotonin receptor, this 5-HT3 receptor, or centrally on the CTZ zone, the chemoreceptor trigger zone. That's in the area postrema. It's a floor of the fourth ventricle of the brain. And that's where it seems that the trigger for the nausea and vomiting comes. So one of those two areas, either the vagus nerve or centrally in the CTZ zone. And it seems that the serotonin is released from the small intestine. And that's what sort of triggers everything. Well, there are 4 medicines in the same family that have been approved by the Food and Drug Administration. That's 4 serotonin HT3 receptor antagonists for the nausea and vomiting. There's Sustol and Sancuso, that's one type. That's Ondansetron. There's the Dolasetron, that's Anzimet. And then there's second generation Polanosetron, that's Aloxi. Well, medicine works really pretty well. It seems that it prevents the serotonin from acting on those particular portions of the nervous system that lead to the nausea and vomiting. Problem is that it's going to be very rapidly metabolized. It's first pass metabolism. So as soon as it gets to the liver gobbles it up and breaks it down. The bioavailability is only between 55 and 60% in healthy individuals. There's a slight increase in bioavailability if you take it with food, but the likelihood of you're taking it with food if you're suffering from vomiting and nausea is relatively small. It's absorbed better in women than it is in men. It's cleared less rapidly in women than it is in men. So that means there's increased bioavailability of the medicine in women than it is in men. Clinical significance of that, don't really know. The medicine, if you double the dose, doesn't necessarily double as far as the amount in your system. Actually, if you go from 8 milligrams to 16 milligrams, you only increase the area under the curve, the amount of medicine in your bloodstream overall, say in the course of a day, by about 24%. So it's not dose proportional. And the half-life of the medicine changes over the course of time. So if you're somewhere between 20 and 40 years of age, the half-life of the medicine is going to be about 3.5 hours. If you're 60 or 70 years of age, it's going to be about 4 or 5 hours. And if you're more than 75 years of age, it's going to be somewhere between 4.5 and about 6 hours or thereabout. And that means that you're going to have an increased bioavailability of the medicine the older you get. The time to the maximum concentration, somewhere around an hour and a half to a little over 2 hours. Now it's going to be metabolized by some of the liver enzymes. That's why you have to be a little bit careful depending on your degree of liver insufficiency. But it doesn't seem that it really is subject to significant change if you're taking other drugs that either induce or inhibit the liver metabolizing enzymes. There are some medicines that you have to worry about because one medicine will increase the dose or increase the amount in the system of another medicine. It doesn't seem that this is relevant in the situation with Zofran. Now, even though if you take an inducer or metabolize an enzyme that's going to break down the drug, it doesn't seem to be clinically relevant. Antacids actually doesn't change the amount in the system. And good news is it's not mutagenic. It certainly isn't carcinogenic. Does it work? Sure does. It's very good medicine. Now, if you're taking the highly emetogenic chemotherapy, the dose is 24 milligrams, solitary dose, single dose. You take it one time. You don't take 8 milligrams 3 times. You don't take 32 milligrams. You just take 24 milligrams. And if you do that, it's going to reduce the vomiting by somewhere around 2/3 and reduce the nausea by about 60%. If you're taking the moderately emetogenic chemotherapy, well, it's going to decrease the likelihood of emesis compared to a placebo. Placebo doesn't seem to work. The medicine works about 60% of the time again. So significant decrease. And it works just as well in the pediatric population as it does in adults. How many people do you have to treat in order to significantly improve one person? You have to treat somewhere between 4 and 5 people. And it seems that in the final year of patent protection for the medicine, the drug actually was the 20th highest selling drug in the United States. In just 9 months of 2006, the sales were about $1.3 billion for Zofran, and 80% of that came from the United States. Well, in the days when it first came on the market, doctors tended not to use it because it was very expensive. Then Teva Pharmaceuticals, 2006, came out with a generic substitute and the price fell. So to buy 2 tablets of the 8 milligram Zofran costs, if you just wanted to pay cash, about $10. If you used a coupon like you could get from GoodRx, could be as low as $1.50. If you wanted the brand name, somewhere between $100 and $150, but if you had a coupon, somewhere around $90. And if you want the orally disintegrating tablet, you want 2 of them, again the 8 milligrams. If you paid cash, somewhere between $10 and $40. If you used a coupon from GoodRx, somewhere between $10 and $20. So that's the story with Zofran, or Ondansetron. It's a very good drug for nausea and vomiting, very frequently used for gastroenteritis, used for the vomiting associated with pregnancy, relatively non-toxic, but as with any other kind of medicine, you have to be careful. You weigh the risks and the benefits. As far as those people receiving chemotherapy, this is the drug. This works very well. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.